All right, we're going to dive a little deeper into the activities of daily living and five very important terms that are associated with these activities of daily living. These are really important. One of them is very important when it comes to long-term care insurance policies. That's critically ill, the terminology there. In short-term care policies, the critically ill portion is not as important because it's a short-term care policy. It may be that they have a broken hip and they just needed short-term care or very short durations of therapy. So the critically ill language may not apply to a short-term care policy. However, it might be good practice to ask about that anyways. So let's start at the top. Functionally incapacitated. That is the terminology that's used when qualifying those activities of daily living that we went over. So the exact definition for functionally incapacitated means the inability to perform two or more of the activities of daily living below without the hands-on assistance or standby assistance of another person. Such functionally incapacitation must be expected to last at least 90 days. So this policy language here basically states that you need assistance with at least two activities of daily living. That's what a functional incapacity is called. And in this policy, it's hands-on or standby. You're going to want to make sure that when they talk about functionally incapacity, that is it hands-on or is it standby or is it both? A lot of the older policies state that it needs to be hands-on. Now, I've even seen a policy that says that they just need the human assistance. And that language is going to be in the functional incapacitation language that's in the long-term care insurance policy. Now, of course, you caught on there too that such functional incapacitation needs to last at least 90 days. So let's go to that bit of terminology, and that is going to be into the chronically ill portion of the policy. So I'm going to go ahead and I'm going to read that definition to you right now. It says, before benefits will be paid for your coveraged expenses, one, a licensed healthcare practitioner must certify that such expenses qualify for long-term care services are needed because you are chronically ill. And two, the elimination period, if any, must be satisfied. The certification that you continue to be chronically ill must be renewed at least every 12 months by the licensed healthcare practitioner. In other words, basically, what is the condition or the incapacity going to last greater than 90 days? And is it due to a chronic condition? So let's say somebody fell and broke their hip and they're now recovering. If they, the time to recover from a fractured hip is usually about 6 weeks, and then they're back to normal. So the question is, why did they fall and break their hip? You're going to need to find or identify a chronically ill condition. They might have fallen because they have a poor gait due to their diabetes, and the diabetes, they've had some neuropathic pain, and they're not able to feel their feet, and which has caused them to trip and fall. Therefore, they need a hands-on or a standby assistance with ambulation and transferring, and then identify two others that they become functionally incapacitated to and that's why that their chronic condition is chronic and is expected to last greater than 90 days. So now let's go to the next portion of chronically ill. Chronically ill means you have been certified by a licensed healthcare practitioner within the preceding 12-month period as one, being functionally incapacitated for a period expected to last greater than 90 days, or have a level of disability similar as may be determined at a future date under regulations prescribed by the scrutiny in consultation with the Secretary of Health and Human Services to the level described in the part that I just mentioned above, or having a severe cognitive impairment. So if somebody has Alzheimer's disease, of course, that is expected to last greater than 90 days, and that would meet the criteria of chronically ill. Okay, so we've covered functionally incapacitated, key terminology there, chronically ill, those activities of daily living that we've identified, are expected to last greater than 90 days because of this functional incapacity that they have, along with the underlying disease state that has caused it. Now let's go on to hands-on assist and standby assist. The definition of a hands-on assist. Hands-on assist means physical assistance without which the individual would be unable to perform an activity of daily living. Or in other words, if the senior is in a chair and they are unable to get out of a chair without human assistance, they require the hands-on assistance to get out of the chair. So if a caregiver or a family member or somebody was not there, they would be stuck there and would have to wait for somebody to come. That would be the definition of a hands-on assistance for transferring. Hands-on assistance for incontinence care means that they're incontinent for bowel and urine, and without your assistance they couldn't clean themselves and change their adult brief. So that's hands-on assistance. Standby assistance means another person must be within arm's reach of an individual to prevent, by physical intervention if necessary, injury while performing an activity of daily living. So an example of a standby assist may be somebody who has had a recent fall, has a history of falls, getting in and out of the shower and the bath, or when they're ambulating and they're at high risk of injuring themselves. They can, for the most part, perform these activities of daily living by themselves, but when they do those, they are at risk of having a fall or injuring themselves, and so a caregiver or somebody needs to be in the room for safety purposes to make sure that they do not injure themselves. I found that a lot of seniors qualify and utilize their policy based on standby assist, but it's important that both the policyholder and the person providing the care understand what a standby assist is. The last one we're going to talk about is substantial supervision. Substantial supervision goes hand in hand with a cognitive impairment. So the definition for substantial supervision means continual supervision which may include cueing or verbal prompting, gestures or other demonstrations by another person that is necessary to prevent a severe cognitively impaired person from threats to his or her own safety. So substantial supervision usually means that a caregiver provider needs to be there to help make sure that they don't leave a stove on and burn the house down. They may need some cueing on eating. They'll look at their plate, they'll see that there's food there, but they won't know what to do with it. So you need to cue them that that's their dinner, it's time to eat their food. Or they may put their food in the mouth and they may not know what to do with it, so you cue them to swallow it and drink it, cue them to get a drink. That would be substantial supervision and cueing. So that's the nuts and bolts when you're qualifying an activity, the activities of daily living. These are the key terminology that you're going to want to understand when you're going through a policy. You're going to want to find out which one of these the policy requires, and is the condition expected to last greater than 90 days? If so, what is the underlying medical condition? They have cancer, they have diabetes, they have dementia. What is the reason why this functional incapacitation is expected to last greater than 90 days? So hope that's helpful in helping you put together your plan of cares.